Great. Okay, well, thanks everybody. And so today we're going to be hearing about greenhouse gases from Scott and Miller on behalf of the large team. And we're also going to be hearing about a specific project within the heat theme team that Bianca Corpuz will be presenting. So Scott, go ahead and take it away.
Okay, sounds great. In the next couple of minutes, I'm going to give an overview of the greenhouse gas work that different folks have been doing as part of BSEC. I'm going to keep things pretty high level, and before I get started, I just want to say that the slides I'm going to show are from a bunch of different folks. Sorry, Ben, I misspelled your name there, but Jason, Ben, Ken, Ben Nault, Peter Groffman, John Duncan, Helen Kenyon, etc. Let's see. So I want to give a quick overview before I jump in of what the goals of the greenhouse gas program have been and sort of are going forward. First of all, we really want to better understand the sources of human-caused greenhouse gas emissions across Baltimore City. And I'll talk more about greenhouse gases from the biosphere in just a moment. We want to understand the interplay between infrastructure and emissions. So how does building design impact emissions? How do traffic patterns and commuter choices impact emissions, et cetera? We also want to understand the urban biosphere. So how is the urban biosphere taking up greenhouse gases? Where is it taking up greenhouse gases and why? Like what environmental factors or infrastructural factors are driving that uptake or impeding that uptake of greenhouse gases? We also want to identify equitable and effective pathways for reducing those emissions. As many people know, Baltimore has a climate action plan, and the city has targeted a carbon neutral goal for many years from now, but we want to start making progress toward that emissions goal. And then we also want to understand the possible impacts of proposed emissions measures under climate change. Baltimore's climate is going to be different in the future than it is today. And so some measures that we might take today, like for example, urban greening or cool rooftops or cool pavement, those impacts might not be the same 30 years from now or 50 years from now than they would be today. So one theme that I'm going to talk about kind of throughout the introduction here is that one challenge I think of the greenhouse gas group is trying to connect observations and emissions that occur at different scales from the street level up to the city level. So, ultimately we want to know how much greenhouse gases are being emitted from Baltimore and are being absorbed by the biosphere in Baltimore. But these greenhouse gas fluxes, they vary a lot from one building to another and one yard to another, one street to another, or one neighborhood to one another. And just one note, I've used in some cases the word fluxes and emissions. I'm using those words here interchangeably. So, a flux being, greenhouse gases that are coming out or going in to a source. So I'm referring to both terms here interchangeably. And then we also want to understand the processes that are driving greenhouse gas fluxes at smaller scales, and arguably that's really key to understanding the big picture. On the right here, I've given some context. Here's an inventory that we helped put together for Baltimore City, showing the city's emissions from greenhouse gas emissions from 2007 up through 2020. And so what our work showed, and this is from Dylan Gita, who's a PhD student here at Hopkins, is that the city's greenhouse gas emissions dropped by about 23% from the year 2007 to the year 2020. And that was just short of the city's 25% goal for the year 2020. The caveat here, obviously, is that 2020 was sort of a weird year, right? People stopped driving their cars for a while. People weren't going into the office, et cetera. And so it's not entirely clear what those emissions in 2020 would have been were it not for that pandemic. But that notwithstanding, we were close, but not quite at our emissions goal. Let's see. And so today I'm going to talk a lot about methane, and then after that, I'm going to talk a little bit about CO2 and the role that these emissions have played within the city. And a reason why we're going to talk about methane is, because I think methane is really uncertain from the city and is really a puzzling emissions problem. A lot of methane emissions at the urban scale come from leaking natural gas infrastructure. So natural gas mostly consists of methane. And so when natural gas leaks, it emits methane into the atmosphere. Other urban sources of methane include wastewater treatment plants and also landfills. But here's a picture on the right that I think is really illustrative of some of the challenges here. Baltimore Gas and Electric each year has to report what it's called lost and unaccounted for gas. So this is gas that came into the city but wasn't billed to customers. And the y-axis here shows the percentage of gas that was lost and unaccounted for. And from year to year, it ranges from 0% up to 4.5%, right? So this is gas that could be leaked into the air. It could also be an accounting error on the part of BG&E. We really want to know what's happening there, and we want to help folks like those at BG&E in their leak detection and repair program to reduce the leaks that are coming from the natural gas system. And again, kind of revisiting one thing I mentioned earlier, one kind of recurrent theme of this greenhouse gas group is that we really want to connect small scales up to large scales. So on the right here are some drive-around measurements that Pete DiCarlo and his group took. I believe this is just south of Clifton Park. And the colors show methane levels that they measured from their van. And anything in yellow is pretty good, but anything in red or black indicates there's probably some sort of street level natural gas leak that's happening at that street. And so you can see even in this relatively small neighborhood that there are a bunch of these leaks happening in different places. And arguably fixing these leaks could be like a game of whack-a-mole. So we both want to know, which streets should Baltimore Gas and Electric target for fixing leaks? And then we also want to know at the same time, how are the city's overall emissions across the entire urban area changing over time? And, are these leak fixes improving the city's overall emissions? So going back to this idea of connecting different spatial scales from the street level up to the city level. So let me start talking about some of the different measurements that folks within the BSEC group have made and what people have found so far. So there's been a project going on within Baltimore for a number of years now called the Baltimore Ecosystem Study that's now been folded within BSEC. And these folks have been taking measurements of methane at the ecosystem level to understand how methane is being either absorbed from ecosystems across the city or released from ecosystems across the city. On the bottom right are some of the figures showing folks taking these measurements. And on the bottom left, I have a time series going back to the late 1990s of measurements of methane fluxes or emissions from different ecosystems across the metropolitan area. And a negative number here means that the ecosystems are actually taking up methane. And what you can see is that, grassy areas are not really taking up methane, but urban forests and rural forests are actually a net methane sink. And that rural forests are taking up even more methane than urban forests. So we don't often think about forests as being as gobbling up methane, but what these measurements really show is that that within an urban area and an urban context that forests have been taking up methane. And again, I'm going to start at kind of a small spatial scale, then move out to a bigger and bigger spatial scale. So Ben Allsweed at Penn State has been setting up what we call eddy flux observations, and their goal has been to understand greenhouse gas ecosystem fluxes, and then also understand neighborhood level greenhouse gas emissions. So to start out, they took some measurements from a grassy field at Clifton Park. You can see there on the bottom left, and on the right, you can see sort of CO2 fluxes or CO2 sort of emissions from this ecosystem. And again, anything that's in negative means that the ecosystem is taking up CO2, positive means that it's releasing CO2. So at nighttime, this grass is respiring CO2, and then during the daytime here, during the middle of this, figure, you can see that the ecosystem is taking up CO2. And kind of as a next step, what they're doing is to installing these types of observations, what we call eddy flux, on 2 telecommunication towers across Baltimore. So I believe one is near Clifton Park. One of the previous slides here, I have a star showing approximately where that site is going to be. And that work hopefully is going to really highlight neighborhood level variability in greenhouse gas emissions across the city. These observations are really going to be sensitive, I think, to emissions across about a kilometer stretch or so. And so when the winds are blowing from different directions, we're going to get a sense of what's happening from different parts of different neighborhoods across the city. And I think this is going to give us kind of a snapshot of individual neighborhoods within the city. Those observations are being complemented by greenhouse gas and air quality observations from a mobile lab that Pete DiCarlo's group has been constructing. So they've got instruments to measure greenhouse gases, criteria air pollutants, so things like ozone and particles in the atmosphere, and then also air toxics, compounds that we really don't want to be breathing in any measurable quantity. And here's a photo of the mobile lab that was taken in Remington. And on the right, you can see what some of that instrumentation looks like. I always think when you see it driving down the street that it looks kind of like one of those big white kidnapper vans. But there's quite a bit of pretty sophisticated instrumentation in here, and their goal is to be driving around the city streets and measure not only neighborhood level variability in greenhouse gases, kind of like what we saw on this figure, but also be measuring air pollutants as well. Let's see. And, at the moment, they've been building this mobile laboratory in a garage located in the Remington neighborhood. And, they've been taking in air from the rooftop of the garage and measuring methane levels. And here are some figures from Ben Nault that he put together. Let's see. Showing both CO2 and methane across the city. On the left-hand side shows kind of a longer time series of a couple months. And on the right-hand side shows kind of what a daily cycle looks like for CO2 and methane. Both for CO2 and methane at the site, we see these really huge spikes. And you'll notice for methane here on the bottom that there's this break in the y-axis, right? That we've got 0 ppm up to 5 ppm, and then a break in some data points that go up to 10, 20, or 30 ppm. And those huge enhancements are probably due to large emission sources. They could be leaky natural gas infrastructure. They could be methane blowing off of the landfill or methane coming from the wastewater treatment facilities. And we really want to get a better understanding of what those sources are and how we can potentially remediate or reduce those emissions. In addition, Kirsten Kohler has been operating a low-cost air monitoring network with about 45 stations in and near Baltimore, and that network has been operating about 5 years or so. These stations measure many pollutants, including methane. So an upside about these instruments is that they are relatively inexpensive. One box containing multiple instruments costs about $1,000 or so, whereas some of the instruments in the mobile laboratory that I talked about can cost in excess of $100,000 or more. So at the moment, we're really focusing on methane from this low-cost sensor network. Again, an upside is that these measurements are cheap. A downside is that these measurements are pretty noisy and they're really difficult to wrangle and calibrate, right? So our hope is that this could be one way or one path forward for monitoring methane emissions from the city in a way that could ultimately be lower in cost and kind of easier to deploy. And a lot of these sensors are located on schools throughout the city, on the rooftops of schools throughout the city. So again, our current work is that this low-cost data is really messy. So we're developing calibration models using machine learning for this methane data to try to, get this data in line so that we can start to analyze it and understand what it's telling us about methane emissions from the city. So here's kind of an example of some training and calibration that we've done. We have one of these low-cost sensors at a high-quality monitoring site that's operated by our colleagues at NIST, the National Institutes for Standards and Technologies. And the red here are points where we've trained our machine learning model, and then blue is where we've run our machine learning model, our calibration model, and then compared how these low-cost observations in blue compare to the high-quality observations in black. And you can see that you can see that we do like a pretty good job, that the blue points do a pretty good job of matching the black line, but they don't do a perfect job of matching the black line, right? So the better that we can do with this calibration, the better we can do at trying to track down methane emission sources across the city. And we certainly don't want to be finding erroneous sources that don't exist because of a problem in our calibration model. And then I think lastly here, what I want to do, again, we've gradually been talking, kind of zooming out, going from small scale plot level measurements to kind of citywide measurements. And for this example here, I'm really zooming out to talk about citywide. Here is some work that Helen Kenyon and Ken Davis's work has been doing. So our colleagues at NIST, as I mentioned, have been operating 4 greenhouse gas monitoring sites near Baltimore. These sites use really high quality instruments as opposed to our low cost sensor network. These are installed at relatively tall telecommunications towers across the city. So they're 60, 70, 80 meters or 60, 70, 80 yards above the surface. And because of that height, they really are giving us kind of a bird's eye view of the city, of variability in greenhouse gases across the city. but they're not really giving us a lot of street level detail, right? So again, these observations are really great if we want to know total emissions in the city, but they're not really going to tell us whether those methane leaks are coming from one street versus another street per se. And so Helen Kenyon has looked at these different observations and tried to estimate methane emissions from around the vicinity of these different tower sites. So her emissions estimate here is shown here, and she's broken it down by month of the year. These emissions estimates are averaged over multiple years. And what you can see is in the top in the red and green are two of the urban sites. One is located near Clifton Park, another is on Reisterstown Road, and then two suburban sites. One's in Halethorpe, Maryland, and the other is, I believe, in Jessup. And you can see that the methane emissions around the urban sites tend to be quite a bit higher than the suburban sites. And we think part of that reason is because of differences in infrastructure in the city versus in the suburbs. A lot of the natural gas pipes within Baltimore City are made from cast iron, and they're relatively old, and those pipes crack over time, and methane can leak, or natural gas can leak out of those cracks, which yields methane emissions. By contrast, newer natural gas systems are made out of plastic or PVC pipes, and those newer PVC type pipes tend to leak less. And so I think that a possibility or idea here is that we've just got older infrastructure in the city that hasn't been updated, and it's not as new as what we see in the suburbs. And so you might expect that we're going to have more methane emissions and more natural gas leaks across the city. And that's what Helen is finding in her work. So lastly, I want to pivot just very quickly and talk about CO2. I've been talking about methane now for most of the talk, and then I think with that, I'll be wrapping everything up here. And one thing that I want to mention that I think is really cool, Jason Horn, who's a PhD student at Penn State, has developed a high-resolution model of CO2 sources and sinks from vegetation or from the biosphere across the city. So, we don't know for sure whether this model is correct, but I think it sort of helps give us an idea or start reasoning through possible sources and sinks from the biosphere, and to be able to compare those against anthropogenic methane emissions, and also to be able to kind of reason through how different types of ecosystems are taking up CO2 or not taking up CO2. So you can see anything in a darker color. Darker purple means that the ecosystem is taking up more CO2. A lighter color means the ecosystem is taking up less CO2. And so, as you might expect, greener areas like Clifton Park or other parks across the city where there's more greenery, Fort McHenry, have got more CO2 uptake than urban areas with a lot of concrete. And this map that he's made or model that he's run is at the resolution of a few kilometers. And so here's a zoom in on Clifton Park. And compared to a lot of the other models that are out there, this resolution is pretty incredible. You can actually see individual buildings within Clifton Park, right? Or areas where you have vegetation versus areas where you don't have vegetation. And again, I think this is helping us to kind of think about and reason through what role the biosphere might play in the city's greenhouse gas sources and sinks. So next steps and kind of big picture questions that we want to answer, looking at human caused emissions, we want to know where and why is methane being emitted across the city. We're starting to collect a lot of observations that we can use to help answer that question. In terms of the biosphere, we want to know how do vegetation fluxes or sources and sinks differ from different neighborhoods. Third, we want to look at how can building retrofits and increased density cut emissions, like what kind of infrastructural changes can we make? And then also explore synergies with other themes in BSEC. There are a lot of connections here between what the vegetation group is doing, what the air quality group is doing, and then also the buildings group is doing. A lot of folks in buildings are looking at the possible impacts of building retrofits or using buildings in different ways and how that interplays with greenhouse gas emissions. So with that, I think I'll wrap it up, and I'd love to chat about any questions that folks might have.
Very cool. Thanks, Scott. There's been some action in the chat going on. Anybody have any questions for Scott or others from the team who want to chime in with more info?
Cool. Sounds great. Well, thanks everyone for listening in, for joining today.
All right, cool. Thank you. Well, keep questions coming in the chat. We can also have time at the end of the day. If people have questions that occur to them. So in the meantime, Bianca, over to you to hear a little bit about your work on the asthma impacts of heat.
I'm going to share my screen. Hi, everyone. Alrighty. Can you guys see this?
Yep, looks good.
Okay, cool. All right. Okay, but it lost on my. Okay. You guys can see my slides?
Yeah, they're fine.
Okay, great. All right, so hi everyone. I'm Bianca and I'm a PhD student. And like Ben said, I will be presenting on one of the projects that we're working on within the health team of BSEC. I gave a presentation previously a few months ago during the BSEC annual meeting. So I will kind of touch on that, give a brief overview of that again, and then also touch on some new results. So the title of today's talk is Examining the Impact of Extreme Heat on Emergency Department Admissions for Childhood and Adult Asthma. All right. All right. So why are we studying extreme heat? All right. So studying extreme heat in Baltimore is important because the city experiences urban heat island effects, and that makes it particularly vulnerable to heat waves, which can lead to different health risks for individuals who live within the city. And we know that extreme heat is important. We have an extreme heat working group within BSEC, but just to highlight this point, I've included a few titles here from various news stations that really drive this point home. So why are we focusing on asthma? Well, extreme heat can lead to various health illnesses such as heat stroke and heat exhaustion and other heat-related illnesses, including respiratory illnesses such as asthma. And these can be particularly dangerous for vulnerable populations. And so, particularly during the summertime, exposure to extreme heat has been associated with an increased risk of hospitalization for asthma in Maryland. So here on the side are a few statistics from the Baltimore city government. We find that 14% of Baltimore city adults are diagnosed with asthma, which is higher than the statewide and national percentage. And 33% of Baltimore city high schoolers have asthma, which is higher than the 25% statewide rate. And Baltimore City has the highest rate of emergency department visits due to asthma for the entire state of Maryland. So we have numerous reasons why we should focus on asthma. And we're able to do this because we have access to high resolution asthma data through our colleagues at the Hopkins Precision Medicine Center. All right. So what data are we working with? We are working with health data, like I mentioned, from JHU PIMCO. And the health data from that are pediatric asthma exacerbations, and those are for individuals under the age of 18. And then we're also using the adult asthma exacerbations, which is for individuals who are 18 years and older. And so again, this is precision medicine data. And so within these data sets, we have access to patient addresses, but for privacy concerns, IRB, and numerous reasons, those addresses are aggregated to their respective census block group and their census tract. Now, for the environmental data, we're using minimum air temperature and maximum air temperature, and those are derived from a model that I will talk about in a few slides. And we're also using extreme heat events, and the way that we're defining that will also be described in later slides. And again, for the study period, we're focusing on summer months of June, July, and August from the years 2016 to 2022. Okay, so first let's take a look at the health data that we have. On the left-hand side, you can see the asthma exacerbations amongst adults, broken up by census block groups. And on the right-hand side, you can see the asthma exacerbations for pediatric patients broken up by the census tracts. And so in total, within our entire study period, we have a little over 819 exacerbations for our adult patients and almost 700 asthma exacerbations for our pediatric patients. Okay, and so now I'm talking about the air temperature data that I mentioned, how we derive that. And I talked about this previously, but in case you weren't there, I just wanted to provide a very brief overview. We used a ground-based network of eye buttons. If you look on the left-hand side, that's what they look like, the little circle in the center of the tree thing. And then we also use satellite data, National Weather Service station data to create urban heat island models. And we created a daytime and nighttime urban heat island model. And so we included both static and time varying predictors in our models, and I've just included a list of them here. Okay, so the models that we used were generalized additive models. And the reason why we use these models are because they allow for us to use covariates with nonlinear and linear relationships with our outcome, which were temperature anomalies. And so we predicted both minimum and maximum air temperature anomalies, and minimum temperature anomalies refer to the nighttime urban heat island, and the maximum air temperature anomalies refer to the daytime urban heat island. And so this is at daily temporal resolution, and we then took these temperature anomalies and then turn them into air temperature measurements. And then we were able to predict minimum and maximum air temperatures for subsequent years. So what I showed you were results from our 2016 model, and we've applied that model for 2017 to 2022, and we can see the averaged summertime temperatures per year here on the slide. So on the left-hand side, we see the maximum, and on the right-hand side, we see the minimum.
I don't think we're seeing the same slide you mean to be showing us.
Really? Oh no. What slides are you guys seeing?
We were stuck on that sort of introductory.
Looking at the eye button picture.
Yeah.
Oh, boy.
Sorry.
Okay, let me stop this share and then try again. Let me just. All right, let's just. All right, can you guys see it now?
Yes.
Okay, so sorry, we'll just do a quick go through. Okay, I think this is the slide you were all stuck on. Sorry, these are a list of the predictors. These are the 2016 daily temperature maps, and these are the 2016 to 2022 summer maps that I was just talking about. Is this where we left off? Yes, yeah, it is. Okay, cool. So now let's talk about extreme heat events. So as you all know, when we define extreme heat events, there are various definitions, and the two that we applied are the Anderson and Bell definition and the National Weather Service station definition, which is what Baltimore uses to apply these Baltimore code red alerts. So when we're talking about the daytime extreme heat event, that's defined as exceeding the 95% threshold for at least 2 consecutive days. And similarly for the minimum, so nighttime heat events, it's exceeding the 95% threshold for more than 2 consecutive days. For the National Weather Service Station and Baltimore Code Red definitions, the daytime extreme heat event is whether or not a day exceeds 40.6 degrees Celsius. Well, if the day exceeds the heat indices of 40.6 degrees Celsius for at least 2 consecutive days, and for the nighttime, it's whether they exceed 26.7 degrees for at least 2 consecutive days. Okay, so how are we studying the association between heat and asthma? So there are 2 common methodologies that we can do this when we're looking at an environmental exposure and their respective health effect. 2 common methodologies include a case crossover design by performing conditional logistic regression and a time series analysis, oftentimes using a quasi-Poisson model. And so here we're using a case crossover design where each case, so each patient is serving as their own control. And the data that are typically used in some of these studies are using environmental data from the nearest weather station. But in our case, we will be using a higher resolution air temperature map because, as we know, the weather station doesn't always accurately depict the temperature at some locations within the city. And sometimes asthma exacerbation data are aggregated to the city level, and here, because of our data set with the Precision Medicine Center, we've aggregated them to the census block group and census tract. Okay. Okay, so today I will be showing the results, preliminary results for the pediatric and adult conditional regressions at the census tract level. So this is a bit different than the results I've shown previously. But on the left-hand side, we can see the pediatric patients. So the blue corresponds to the nighttime air temperatures and red the daytime for both adults and pediatric patients. And so what we can see is that in pediatric patients specifically, we do find a higher risk of asthma exacerbations on warmer nights than on hot days. So for most hot days, the results are almost null. They're not statistically significant. When we look at the adults, however, we kind of see a mix where, some nights are, they correspond to a higher risk of asthma exacerbations, and also on warm days, it seems to have a protective effect. So this can actually be a little bit confusing because what we're saying is for a day of lag 0, so for a day of lag 0, which is the day of the asthma exacerbation, for adults, if they're experiencing a hot night, then they'll have a higher risk of asthma. But if the night before is hot, well, it's not statistically significant, so we can't say for certain if there is a high risk associated there. So we've kind of taken the approach of applying a extreme heat definition to combat this messiness. And so we've taken the Anderson and Bell extreme heat event, and we've applied that. So on the left-hand side, you can see the pediatric results, and on the right, the adults. And so in pediatric and adult patients, the risk of asthma exacerbations is seen to be higher on warm nights if they have experienced an extreme heat event within the week leading up to the exacerbation. And so when we're looking at the daytime, we kind of see no statistical significant results there. But we do see a result for the nighttime extreme heat event. Now, when we apply the National Weather Service Station data, where is this? Yeah, so when we're using the National Weather Service Station and the Baltimore Code Red thresholds, we're able to see a protective effect against asthma exacerbations in adults if they experience a daytime heat wave in the week prior to the exacerbation event. But for pediatric patients, we don't see the Baltimore code red threshold statistically significant or telling of an increased risk of an exacerbation amongst those patients. All right, so those are our preliminary results. So next we plan on conducting these analyses using different temperature data, which have different spatial resolutions, and we will be conducting these analyses at the census block group level, and possibly we will include covariates into the model. Okay, cool, thanks. And questions?
Thanks so much, Bianca. So there have been a couple of questions in the chat
Okay.
related to what might expect about the confusing results. So
Mhm.
yeah, I think you addressed Ken's question about whether hot days have fewer asthma exacerbations. Or maybe you just want to clarify what those negative coefficients are mean.
This suggests that for hot days there are fewer asthma. So, no. Well, let me pull up the slide again. Let me see. Dun dun dun.
Yeah, and that, I was thinking specifically of that first plot you showed
Mm-hmm.
where there were positive in the day and night and negative in the day for adults with the
So,
increasing lag time. Does a
yeah,
negative
so
coefficient for adults imply that 3 to 4 days out, there's statistically fewer after a hot day? Or am I interpreting that incorrectly?
I think we can interpret it as like the risk of having an asthma exacerbation is reduced. So it seems like it's a protective effect.
Okay, all right. Interesting, got it.
I don't know why I can't see the questions. Okay, well, I'm sorry, one more.
I could read if you want.
If you
Mir-
could, please.
Miriam has one, says, could this mean that people need nights to reset themselves, or that more people have access to AC during the days than during the nights? Or are these kinds of questions not useful at this point? Of course, Miriam's on, she could ask too.
Yeah, that's a good question. I think when we're thinking about the extreme heat events during the day, we could probably assume that individuals, I mean, adults specifically, are at work maybe. But yeah, for the nighttime, I think having air conditioning data would be really useful. We don't have that right now. So we're not sure if, the reason why there's an increased risk is because individuals aren't able to, have their homes set at a temperature that is comfortable for them. And so that's a great question. And I think we would love to try and get at that using air conditioning data. But that's a great question. And it's
It might
something that
also be interesting to know, to look at asthma exacerbations against how long it's been hot for.
Mm-hmm. Yeah, so right now we are taking we're taking into consideration how we're defining extreme heat events. Again, like how long it's been hot for, and yeah, these are just our preliminary results, but yeah, that's something we're considering. Okay, could this mean, okay, have you thought about considering relative humidity? Yes, so when we're defining our definitions of extreme heat using the National Weather Service station in Baltimore Code Red definitions, we are including relative humidity in those definitions. But within the models themselves, we're not including relative humidity at the moment. We're only including air temperature, but it is important to include relative humidity, I believe, because it is confounding, and there are numerous confounding variables that could be the reason asthma exacerbations are occurring. Okay, suggesting a protective effect is no, absolutely, right? So we're trying to get rid of that assumption and belief that there are that daytime temperatures are protective, because they're certainly not. And so yeah, again, we do have to include different covariates in the model to address those confounding factors. Building models. Okay, well, Is there anyone in the buildings modeling group? Because that would be great.
I don't know if anybody's on board, but we can get in touch with them easily.
Fantastic. I didn't know that we had air conditioning data.
I believe they have some HVAC information.
Huh.
It'd be
But I
worth
think it's
asking.
aggregate. I don't think it's by individual house. And I think for this kind of correlation, you want to know at the individual level if they have air conditioning or not.
But they do have information distributed by neighborhood, I believe. So it might work. It's worth
Yeah.
asking.
Yeah, maybe there could be a way of addressing it because the individual health data, they I mean they're technically at the household level as the raw data, but we've had to aggregate it up to
Right.
census block group and census tract. So maybe if we can get a percentage of households with air conditioning, maybe we could work something out.
Ben has a hand up too.
Okay, Ben, do you want to ask your question?
If I can get unmuted, I will. Okay. Hey, thank you. I guess my first question is just that I'm confused. This plot that you're showing right now, I guess, confuses me because warm nights tend to follow warm days. They tend to go together.
Yeah.
So how they could have alternate effects, but I think that's probably why you went to the heat wave definitions.
Mm-hmm.
So I'm wondering if you could go to those slides and just kind of reiterate the main message here, because I don't quite understand.
Yeah. So when we're using yeah, you're right that the results that we showed when we're using air temperature as a continuous variable, the results are quite messy and they're difficult to understand and parse through, and we're unsure if those are even true. So we've aggregated, we didn't aggregate, we like took these extreme heat events and we've determined whether the days are an extreme heat event. And so this analysis is showing whether an extreme heat event within the week leading up to the exacerbation is related to an asthma exacerbation. Does that make sense? So whether an extreme heat event occurred within the 7 days before they came into the hospital, instead of looking at whether the air temperature was hot 1 day before or 2 days before or 5.
And it looks like what this is showing is that the daytime heat waves don't show anything terribly significant, but if heat waves at night are felt, that's tend to be correlated with higher incidences of asthma.
That's right. That's
Okay.
right. So the risk of asthma would be higher on warmer nights. Yeah. Okay, one more question. So also wondering if some ED emissions are related to heat-related ED emissions. Could people with asthma be at greater risk for heat-related? That's great. That's a great question. So for our data set, our exacerbations are only taking into account the codes for asthma, but we haven't included heat-related ED admissions. And I don't know if we're able to do that or if we have enough data to do that. But yeah, that is something we should look at. It's a great question. Nearly methane flex note.
Off topic, don't worry about it. Back
Okay.
to the greenhouse gas, just for the greenhouse
Okay.
gas.
Cool. Any other
Just-
questions?
Can I just expand on something that Ben Allsweet said, and Bianca, I think you gave a good explanation there, and why you've been moving towards this heat wave index approach as opposed to the continuous predictors. But this question of the correlation between warm nights and warm days, right? Because you might think that, 90% of these things are happening at the same time, that when you have a hot day, you have a hot night. But Bianca, correct me if I'm wrong, but for the period of your data set, I don't know that that's true, right? Obviously, there's some association, but like they don't actually happen at the same time. Can you talk about that a little bit?
I think you've covered it, but yeah, they're not, like, a hot day does not always correspond No. A warm night doesn't always correspond to a hotter day. So, and it could also be how we're defining our days, honestly. It could be, so the way that the health data set are defining days is like midnight is the start of a new day. And so maybe the way that we're defining it could be adjusted.
Yeah, and it also has to do, I mean, it's how you define days that way. And also the heat wave definition, right, is about a percent exceedance from a baseline, right? And so think about Baltimore, right? It's humid, soupy. And so during the day, you might get really hot days under conditions of like sunny, kind of relatively dry by Baltimore standards conditions, whereas weather types that lead to warm nights are those really humid times, and so with a high dew point. And so there's a surprising lack of association between high daytime and high nighttime temperatures when you calculate it that way. Though, Ben, you're absolutely right that like in general, when it's hot, it's hot.
But I think you all touched on everything that we've already started working on, and it's just it's something difficult that we're tackling, but we are slowly but surely. Yeah.
Cool. Thank you so much, Bianca. All right. So that gets us through today's agenda. Any other late-breaking questions or comments about what people heard today?
Yeah, we need to hear from all the Bens, so I better pipe up. Yeah, I'd like to ask Scott a question. Maybe this is not fair since it's been so long since the presentation, but so I've seen data from New York City where the gas providers there, Con Ed and National Grid, are right now about half their mileage is in the old-fashioned iron leaky pipes, and half their gas pipeline mileage roughly is in the less leak-prone plastic pipes. And they have a program of replacing the iron pipes, and they're projecting that the amount of leakage from the distribution system over the next 20 or 30 years, they hope will go down by something like 90%. I forget what the exact number is. And I'm wondering whether BG&E has provided, what sort of program do they have for systematic pipe replacement? I know our rates are going up for that reason. And do you know if they have a projection of what's going to happen to their leakage over the next, few decades? If there's any data like that you could use for projecting into the future.
That's a good question. So they do have they do have a pipeline repair and replacement program. I was looking at the website for this program the other day, and it was just kind of very generic, didn't list specific targets. Or at least that's my recollection. I know I don't, Ken Davis, I don't mean to put you on the spot, but I know you've been chatting more with BG&E. Do you have a better sense of like what the timeline on that might look like?
I can't report a timeline. I know that there's progress, and if possible, Ben, we'd love to be able to do comparative study of areas that are and are not upgraded. But I don't think we know yet where the areas are. But if we could do that comparison of the areas that are and are not upgraded, I would say we'd have very good empirical information about the likely impact. We don't have it yet, but I think we'll get there. I'm optimistic that we'll get there.
Yeah, I'm hoping that the distribution companies aren't, being, indulging in a lot of wishful thinking about how effective their programs will be.
I'll note we've been measuring Indianapolis for a decade, and Indianapolis is all plastic pipes, and it does not leak much at all.
Oh, hurrah. That's great news.
Yeah, I think there's good evidence that it really does help. How much quantitatively, I would hesitate to say I've got the number, but Indianapolis is tight.
I've always known that, but
in terms of methane leakage, my friend, that's what I mean.
Oh, okay. Thanks, Ken.
Also, that
And thanks,
plot,
Scott.
oh, sorry to interrupt. That plot that Scott showed with the urban methane emissions and the suburban. Where the urban was higher, we suspect that that may be because the urban areas have cast iron pipes and the suburban areas have plastic pipes. So that could potentially be an example of the difference, but we don't know for
Yep.
sure what else could be going
Yep.
on there.
Yeah, we haven't confirmed, but that figure from Helen's work may show this comparison exactly. That was like a factor of 3 change, roughly.
Yeah, I think so.
I was just gonna jump in and ask, do we have any conversations ongoing with BG&E about areas that they're planning to upgrade? Because I think what could be interesting to kind of close the loop on this is to do measurements pre and post and see what kind of leakage change we get. So we can do where are the leaks, we can try to estimate fluxes. We have a flux attachment for our backpack. And then see after they do the upgrade, what things look like. I will say that on some of my bike routes, I have noticed when they change the pipes because the street gets all messed up, but I
Oh.
still will smell mercaptan or the sulfur things after the pipe replacement happens. And I don't know if that's a curing
Yeah.
thing. It takes a while for the pipes to set, or if they're just not done 100% with no leakage. So
When the other concern there, Pete, also is it might not be the distribution pipes, it might be the appliances.
I mean, I'm on the street in early morning hours. It's pooling in certain areas. So I'm guessing it's from the street and not at someone's home. But we can also measure in home. My home has 3 ppm, not 2 ppm. So there's something leaking.
Yeah.
Mm.
My office building has 2.5 to 3 ppm. And it's correlated with ethane,
Yeah. Well,
natural gas leak.
All right. Well, on that cheerful note,
no, do we have, but does anyone have an answer to that? Do we have a conversation with BG&E about, or can we try to get something with BG&E about either their timelines for pipeline replacement or where they're planning to do replacements next so we can do pre and post measurements?
This isn't totally pipeline replacements, but we had been talking with BG&E about getting information about their pipeline leaks and repairs. So not exactly replacements, but we still haven't heard back from them about that.
Do you know, so I talked a lot with Philadelphia Gas Works when I was in Philly, and they do a full survey of their system, which is 3,000 miles of pipes twice a year, and they don't record any of the data. But if they peak above 50 parts per million, they send a crew to replace the pipe. But they have the entire pipeline thing surveyed multiple times a year, and they just throw the data away. I don't know if it's a liability thing, but I don't know if BG&E does something similar.
From what they told us, it seemed like they have that data, but we didn't get super far talking to them about it. But it seemed like they keep track.
Ava, I'm hoping you have some thoughts.
Yes, I have one thought. We are working with ECLI to do a regional greenhouse gas inventory for the Baltimore metropolitan area. And so they should have received like utility data from BGE. I don't think that always includes like the fugitive emissions or any leakage data. I'm not exactly sure, but I can definitely check with them to see. I know they have the I think it is in there, but it is aggregated across the 7 counties, or 6 counties in Baltimore City. And then it is broken down by county as well.
Let's see, the Public Service Commission of Maryland, which is headquartered in downtown Baltimore, regulates BG&E and is, very concerned about the cost of these programs. It's possible that they will know something about the data that you're looking for, whether there are ex ante and ex post measurements to look at the effectiveness, that sort of thing. If you'd like, I could nose around and see who at the PSC might be knowledgeable about this. Hopefully somebody.
Don't know, Ben. So far, BG&E has been in discussion and interested in cooperating.
Right?
They're just cautious and slow, which is understandable. So if it sounds like what you're saying is, could we pressure them from above? But I don't know.
Oh, I don't know about pressure, but they might know about it.
Oh, okay.
And of course it wouldn't, might not. I don't know if that rises to the point of pressure, but
Yeah.
we're checking with the PSC. There's also the People's Council, all of whom are very concerned about the expenditures on this program. So could be that they say, oh yeah, of course we get that data, or maybe they don't and they ought to.
Okay.
But definitely don't, if you think you have what is a good relationship that's making progress with BG&E, now there's definitely no reason to put pressure on them. You might,
Yeah.
let's see independently what I can find out.
Maybe we could come up with evidence for the PSC about the benefits of the refurbishing,
Mm-hmm.
if we can collect that data.
I would love to have a contact, or if people have contacts there who are on this program, I could even potentially get them to lecture in a class about the program, and then we can go out and use that as an opportunity for students to make measurements of methane leakage, and kind of close the loop. People are often more amenable to teaching students, and we can get information that way and start that relationship. So if people do have contacts, let me know and we can try to move forward.
To follow up on that systematically, right? Because I know, Chloe Bean has been our direct administrative contact there, but it sounds like maybe some other folks are already talking to additional people on that team who could be useful.
Yep.
All right. I see we're over time. Thank you all so much. Special thanks to Scott and Bianca. And we will be in touch soon. Oh yeah, so next month is the Cross IFL seminar on flooding. And so then we'll be back for our next research chat with veg and soils and water in, I guess that'd be December already. Wow. All right. Talk to you soon.